of an altered mood or hallucination and induced, in which the recipient, being a healthy person, reproduces the delusional system of the inducer and mentally ill person. So first classification at primary and secondary, and sometimes induced, yes, induced person. Next one, when we classify delusion according to the degree of systematization. It can be fragmentary delusion and systemized delusion. Systemized delusion when patient has the high level of systemization, a lot of small detail of the main idea of this of bubble of his delusion, and fragmented when he has only based understandable ideas. For example, he knows that someone wants to kill him, that's all. So he has persecutory delusion without any without any external detail information. So systemized and fragmentary. According to the content, we have the following variants of delusion ideas. They this delusion idea are distinguished. First, ideas of relation and meaning. Other notice the patient look at him in a special way, for example, hinted by their behavior at his special purpose. He is, patient. Patient is in the center of attention and interprets the phenomena of the environment that were not previously significant for him as essential. It's a delusion idea of and meaning. Ideas next form. Sorry. Ideas of persecution. Ideas of persecution means the patient believes that he is being followed, finds a lot of evidence or surveillance, finding hidden equipment, gradually noticing that the circle of person is expanding. He claims, patient claims that his pursuers irradiate him with a special equipment, for example, some policeman equipment and like this, or influence him with a hypnosis, or control his thoughts, control his mood, behavior, and desires. This variant of the delusion of persecution is denoted by the delusion of influence. The ideas of poisoning can be included in the system of persecution. A transitive delusion of persecution is also possible while the patient himself brings to imaginary pursuers using aggression against them. The next form is the idea of jealousy. The ideas of jealousy consist in the conviction of adultery, while the arguments are characterized by absurdity. For example, the patient, for example, assures that his partner performs sexual intercourse through the wall, like this. Next one, delusional idea of grandeur. Grandiose delusion, sometimes we can call them. The ideas of greatness, and these ideas, they are expressed in the patient conviction that he has power, specific power, in the form of exceptional strength or energy, due to divine origin and numerous wealth, exponential achievements in the field of science or art or politics, or the exponential value of the reforms proposed by him. It's a different form of grandiose delusion. It can be love delusion. Love delusion is expressed in the subjective belief that she or he, patient, is the object of love of a political figure, of someone, of movie star, or a doctor, or very often when gynecologists they meet and they occupation with love delusion. And love delusion, the specified person is in love delusion, patient with the love delusion. They are specified person, and is often persecuted. They persecute and forced to respond to the feeling these doctors or partners or someone famous person, and like this. And the third group of delusional idea is delusional ideas of self-humiliation. It group includes ideas of guilty and self-blame. Ideas of guilty are usually formed against the background of a reduced mood. The patient with ideas of guilty is convinced that he is guilty of his actions before his relatives and society. He is waiting trial and execution for his condition. Next form of this group delusion is a hypochondriacal delusion. Hypochondriac delusion. The patient interprets his somatic sensation or paresthesia or synestopathy as a manifestation of an incurable disease. For example, AIDS or cancer, it's a better cancer, requires examination, except the death patient with the cancer, yes. Next form, it's a nihilistic delusion. What does it mean? Very often when in some literature you can find two terms of this condition when we call nihilistic delusion as a Cotard delusion. Cotard delusion. Nihilistic delusion, in the nihilistic delusion, the patient claims that he has no insiders. He is rotten. Similar processes occur in the environment. The whole world is dead or is at various stages of decomposition and so on. It's a nihilistic delusion or Cotard delusion. Of course, it's not academically clear to combine these two delusions, but for this stage, for students, it's enough to know that sometimes it's the same symptoms. The next form is double delusion. This delusion consists in the belief that there is a positive or negative, and that is embodying negative personality traits of a double, who may be at a considerable distance and may be connected with the patient by hallucinatory or symbolic constructions, very specific hallucinatory perception. Next form, it's a dysmorphic delusion. Dysmorphic delusion. The patient, most often a teenager, this form of delusion, this form is common for teenagers. So, dysmorphic delusion is convinced that patient has a changed face shape, or there is an anomaly of the body, most often in genitals, or insist on surgical treatment of these abnormalities of his body. Of course, these false beliefs, this illness beliefs, he hasn't this abnormalities, this ugly face or ugly part of his body and so on. He believes in this and he sure that he has, and it's impossible to correct him. It's impossible to explain that he hasn't these abnormalities. Next form of thinking by disorders of thinking by content is overvalued idea. Overvalued idea. Overvalued idea includes super valuable ideas, which are not always false conclusions, and they develop in special sthenic personalities. But they dominate their mental life, displacing all other motives. This is no criticism of them. We can't say that overvalued idea it's a normal, it's a healthy mental, it's a normal mental activity, but at the same time, overvalued idea doesn't illness, psychiatric disorder, psychiatric disease. So overvalued idea located between normal and between pathology. Examples of overvalue idea formations are the ideas of revolutionary transformation of the world, or overvalue ideas of invention, or including the invention of the perpetual motion machine, or the elixir of or the philosopher's stone, and so on. It's an invention, forms of invention of overvalue idea. And the last form of overvalue idea is ideas of physical and moral perfection. Perfection with the patient can think that he is the more beautiful, the most clever, smart, the most gentle person of the world, even he hasn't this characteristic, he hasn't these abilities to think like this, but he will believe, and it will be possible to correct his thoughts in this condition. So, overvalue idea. Next one is obsessive thoughts, obsessive ideas. What does it mean? Obsessive thinking is characterized by stereotypically repeated thoughts or ideas or memorized actions, fears, rituals, and all of them occur against the patient's will, usually against the background of anxiety. However, unlike nonsense and super valuable ideas, there is a complete criticism of them. What does it mean? It means that patients with overvalue idea or patients with delusions, they don't have criticism for their condition. They can't, I have already told you about this today, but I will repeat again, that they can't understand, they can't realize that they have psychiatric illness. Patients with obsessive idea, they understand that these thoughts inside their mind, inside their head, these thoughts, they are illness, they are wrong, and they try to find the help, they try to correct them, but they can control, they can opposite these thoughts. Obsessive thoughts can be expressed in repeated memories, obsessive doubts, for example, in memories of a melody heard in insult in the stroke, or obsessive doubts and rechecking the gas turned off, or rechecking of the iron or closed door, and so on. All these forms of obsessive thoughts can be, and they are very common. I'm sure that you saw them in your life. Maybe some of your friends, relatives have relatives, they have this one, or you saw in the film. There is very interesting film, Aviator, with Leonardo DiCaprio. If you will have free time, please find this film and look at it, because very interesting. Aviator. Okay, so obsessive ideas. Obsessive attraction is, sorry, I have forgot that obsessive ideas can be different forms, can be fear of causing harm, it can be aggressions, religious, it can be sexual obsessive thoughts, dirt or contamination, and they can be accompanied by compulsions and so on. Obsessive thoughts, obsessive idea, it's better call them, obsessive attraction is also combined by obsessive thoughts that must be impulsively fulfilled. For example, compulsive theft, or another name, compulsive theft, is a kleptomania. I'm sure that you hear this term and know what is it, obsessive theft. Then obsessive arson, or another name like pyromania. Obsessive suicidomania. Obsessive thoughts can lead the phobias. That is obsessive fear. For example, fears of crowded places and open spaces. We call this kind of fear like obsessive fear, is agoraphobia, or obsessive fear of closed space. We call like a claustrophobia. Obsessive fears of pollution, it's mesophobia. or there is another obsessive fear of contracting a specific disease, it's a nosophobia, or even there is a specific fear, obsessive fear of fear. So there are a lot of forms of fears, and it's impossible to calculate all of them, impossible to count all of them, because any objects, any subjects, event, social act, everything behind us can be the reason for fear. And there are very seldom forms of fear and very common forms of fear, but it's very hard and not hard, it's impossible to calculate them. And when you will learn about stress-related disorders, you will read about 4 big group of phobias. In psychiatry, we combine all of them into 4 big group. You will read about this later in our lecture or in the class, and I hope you will enjoy this information. How to differentiate fear and obsessive fear or phobia? Because fear, it is a normal emotional reaction. All of you have fear, and it's a normal reaction for some condition. For example, it's a dangerous condition for your life, and you should have fear in this condition to save your life. It's like sorry, I forgot this term. Like a normal reaction for situation which help you to save your life, to protect your health, and so on. But pathological fear called obsession, it's a disorder, it's a psychiatric disorder, it's necessary to treat them. Fear, it's always a normal reaction for situation, and fear, patient will have fear only in dangerous condition. Phobia, patient can have in normal, in undangerous situation. If he will see the picture with the object, for example, he has fear of dog, for example, dog's fear. And if he will watch TV, will watch film, and inside this film he will see the dog, and he will have the same fear, the same symptoms as this dog will be near with him, it means that he has phobia, pathological fear, or illness fear. And the second diagnostic criteria, the second difference between normal fear and pathological fear. When you have fear, and this normal fear, and even it's very hard for you, even you have tachycardia, booming, and so on, and you're afraid very much this condition and very dangerous condition for your life, but you can understand and you can control your mind. You can, you have thoughts in your mind that what should you do to protect your life, to what plan, what acts you should do in this situation. Normal fear. Pathological fear, it's impossible for them to control their mind. They lose their mind in this second, in this moment. They can't think, they can't analyze, they can't do anything. I hope you understand. If you will have questions, I will answer later, or I will explain more detail for you in our practical class. What next? Then we have finished with thinking and speech, and we have a little time more, and several minutes more, and I will explain you the second component of mental examination, mental state examinations, memory. Before we'll speak about pathological symptoms of memory, it's very necessary to say what is it normal memory. There are several definitions of memory. We can define memory as is a collection. Memory is a process of collection, storage, and extraction of information from a rather complex system. Like other mental functions, memory isn't isolated. Memory relies on perception, interacts with the thinking and imagination. Memory correlates and enters into the personal components of consciousness. Narrow memory is a repository of an individual's inherent or acquired experience. In relation to a person, memory is the memorization, perseveration, and reproduction of individual experience. So this is the most important concept of memory. If we speak about pathology of memory, it's necessary to say that among the memory disorders, quantitative and qualitative changes in memory are distinguished. First group, it's quantitative changes in memory. In this case, we can speak about hypermnesia, hypomnesia, and amnesia. What is it, hypermnesia? Hypermnesia is characterized by an involuntary influx of memories of the past and increased ability to capture prolonged retention of information and ease of its reproduction. Hypermnesia is characteristic of some paroxysmal disorders, for example, intoxication with a psychoactive substance, or one of diagnostic criteria of mania and hypomania, hypermnesia. As a monosymptom, hypermnesia can be in mentally healthy individuals. For example, Richter, students who had musician education, who played on piano and so on, know who is this Richter. For example, he had such hypermnesia.
At the back of my mind, I know all of them are the same, so I'm not going to stress myself. If they think I'm naive, I pity them. I've chopped too many. It's not because I've chopped, but faith, I've chopped.
Thank you, Grace. Richter, he had such hypermnesia, and he many years later remembered that the car in which he was taken to a performances many years ago looked like, and what the hands of the boy who lived through the score for him at the performance looked. So how you see how it's how increased his memory. Yes, he can remember tightness, very small detail of performances of his life, which he had many years before. What else? Second one, hypomnesia. Hypomnesia is the opposite symptoms of hypermnesia. We can define hypomnesia as a weakening of memory with the difficulties of memorization and difficulties with the retention and reproduction. It is typically for asthenic conditions or for depression or for organic disorders, for example, for dementia and so on. Hypomnesia, weakness of memory. Next one, amnesia. Amnesia can be defined as a loss of memory fragments. There are several forms, okay, later. Dissociative amnesia, I will explain you forms of amnesia, don't worry. Dissociative amnesia is a distinguished, characterized by forgetting of dissociative amnesia is the first. Sorry, I'm tired. There are several forms of amnesia. First of them, dissociative amnesia is emotional dissociative amnesia characterized by the forgetting of emotionally significant traumatic events, stress events, psychotraumatic events. And this emotion is a special case of extreme displacement as a nature property of memory to move the memory of a traumatic events into the unconscious. In this case, I mean in dissociative amnesia, the reproduction of the memory is possible during the psychoanalytic processes or in hypnosis. I mean kind of treatment this condition, yes? Now, more detail about type of amnesia. As I told before, dissociative amnesia, then retrograde amnesia. What is it? It's a loss of memory for events preceding in the injury, more often traumatic brain injury, and so on. So events preceding this cause these etiological factors. Antegrade amnesia, it's a loss of events that occur after stress or traumatic brain injury or after these etiological factors. Congruent amnesia. Congruent amnesia is a period of time corresponding to the period of the disorders of consciousness or a painful mental state. Congruent amnesia is located between antegrade and retrograde amnesia. So retrograde, congruent, and antegrade amnesia, if we speak about, if we classify amnesia according to duration, according to time of these etiological factors. Sorry, fixation amnesia. It's forgetting current events, including those coinciding with the trauma, most often with the events of the current day. For example, someone called you 1 hour ago and said for you something very important in your life, and you can't remember that. Or in the beginning of our lecture, I said for you some definition, but in that period you check your Instagram, right? They were more interesting for you to look at pictures in this period, and now it's impossible for you to remember this definition because you paid your attention for another particular activities and the fixation of amnesia. Then one, progressive amnesia. Progressive amnesia is characterized by a consistent distraction of memory from the present to the past, while the events of the distant past are remembered better than events of the present or the immediate past. When we speak about progressive amnesia, it's necessary to say about that progressive amnesia determined by Ribot's law. What does it mean? It means memory impairment occurs in most organic atrophic disorders of the brain. That, do you remember? Alzheimer's disease, like vascular dementia, and so on. The reproduction of memory traces can be disrupted as a result of speech disorder. And in this case, the patient cannot name the object because he doesn't remember what it is called, but remember what it's need for. Because these symptoms like amnestic aphasia. For example, you take a pen and can't call this object because you forgot. You know, you can say that I have this term in my tongue, but I can't catch it. I can't remember, but I know what is it. I know how to use this pen and I can describe, so on. not pen, object. Yes, it's amnestic aphasia. Next form of, yes, I told about all forms for you, about amnesia. And next form of pathology of memory, the last one, it's qualitative changes in memory. It's called paramnesia. Paramnesia is a process of distortion of memories, and paramnesia includes confabulation, pseudoreminiscence, and cryptomnesia. Confabulation, the replacement of areas of fallen memory with the fantasies or fantastic delusional constructions. For example, in this condition, we can call like confabulatory delusion. In this case, the patient tells about the exploits, about the achievements, wealth, or crimes allegedly committed by him in the past. It's a confabulation. Confabulation has fantastic fantastic meaning, fantastic unreal situation in his life. Next one, pseudoreminiscence. Pseudoreminiscence is the replacement of areas of disturbed memory with a fragment from another part of the past, and that actually happened to the patient. This memory resembles a confusion of dates. For example, he said for you that I remember that yesterday my father came and brought for me presents like this, but you know that his father died before 10 years ago, but he could brought for him present, he could came and brought it, but patient has problem with the date of these events. The combination of fixation amnesia, retro-antegrade amnesia with the confabulation and pseudoreminiscence is typically for Korsakoff syndrome. Some of you, I'm sure that group number 7 and 8 know what is Korsakoff syndrome. Today we have discussed with them what is it. And if they don't have fixation amnesia, they can call what is it, yes? And the last one form of paramnesia, it's a cryptomnesia. Cryptomnesia, what does it mean? Patient attribute to themselves memorize and information received from other persons. For example, from literature sources, from films, from music, from some story which he heard before, which he had heard before. Usually, not usually, sometimes this phenomena, I mean cryptomnesia, of organic, it's a pathognomonic sense for organic disorders and delirium. And I have forgot about ecomnesia. Ecomnesia. It's ecomnesia, it's the feeling that what happened earlier happened in the past or was seen in dream and then repeats. Usually, such events are given an extra valuable value and you feel so excited because of this. It is characteristic of delirium very often or organic disorder, in particular for delusional interpretation of the past. Ecomnesia. So we have finished our lecture for today. Now at 4 and 20 minutes, we hadn't rest because I should stop.